Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video in response to a question someone posted on one of my videos asking what they can do if, or what one can do if they're allergic to a lot of different families of herbs and they're dealing with some type of a chronic infection where normally we might prescribe herbs for addressing that type of addressing infections, but if they're allergic to a bunch of different types of herbs, maybe it's not safe for them to pursue that. So I'm more than happy to chime in on that. As per always, this is not constituting any type of medical advice, and please consult with your personal health care authority before pursuing any treatment or acting on any of the information that you might hear me say. This is just for informational purposes only. So with all of that out of the way, it's a really good question. I mean, what I would generally say is that there are certain herbs or certain herb families that are more commonly associated with people being allergic to them. So, for example, some people are really allergic to ashwagandha, or they're allergic to calendula. Those are more common herbs that somebody might be allergic to. Or some people aren't allergic to it, but they'll get a rash using the herb lomatium or the herb andrographis, which are two, in my experience, very useful herbs when it comes to dealing with chronic viral infections, or there's some evidence indicating that andrographis has an anti-Borrelia effect, which is the Lyme disease causing bacteria. So if a patient came to see me and they were having a reaction to one or more of those herbs, I might say to myself, well, maybe it's not a general herbal sensitivity that you have. It might be you just have really bad luck and you picked herbs that are, you're on herbs that are either more commonly sources of allergens, or you're reacting to the herb in a different way. But if there was evidence to suggest that, every time they take an herb, they're reacting to it, they're having allergy type symptoms, then there are definitely other tools that we might want to look at exploring. Certain non-herbal antimicrobial implements could include potentially using something called silver hydrosol. It's really not my go-to thing to use in general. I found that it doesn't seem to work nearly as well as herbal formulas do, but that would be a non-herbal option that I might consider for some of my patients. I might also consider using low-dose immunotherapy, or LDI for short, and I have other video clips about that, or if you want a longer in-depth discussion about LDI, I do have a YouTube video that goes into that. It's about 45 or 50 minutes long, but that therapy, it's not antimicrobial. Like LDI therapy doesn't directly kill microbes, but it can help to address the issues with immune system function related to particular microbes. And in some cases, that's the only thing that we've needed to use in order to help someone get well who's dealing with one or more chronic infections. So that's another tool that could potentially be used. Over and above that, there are certain IV therapies. So, for example, high-dose intravenous vitamin C, or intravenous photobiomodulation, or intravenous ozone therapy could be useful. That's quite a bit more expensive and cumbersome than using herbs, which isn't to say we don't use them together in many cases, but one could potentially just use IV therapy to try to go after the microbes in the body. And then there's other things that could be considered. For example, if there was a viral infection, then perhaps using high-dose vitamin A, which you always have to be very careful with that because it's not safe for pregnant women to work with, or women who might potentially become pregnant. And also with high-dose vitamin A, it has to be really monitored carefully, because too much vitamin A can be toxic for people just in general, because it's a fat-soluble vitamin, so you have to be careful with that. So that's just a sampling of some of the things that could be used in lieu of herbs if one just couldn't work with herbs for some reason. So I hope that information is useful. I hope that answers the question for the person who asked. If there's any other questions about this topic or anything else, feel free to post it in the comment section below, and I will do my best to answer it if I'm able to.